Prostate cancer develops in the prostate gland, a small walnut-shaped gland in males responsible for producing seminal fluid. It is one of the most common types of cancer among men. While some forms of prostate cancer grow slowly and may require minimal or no treatment, others are aggressive and spread quickly. Early detection is key to managing and treating this condition effectively. Signs and symptoms. Prostate cancer in its early stages often does not show noticeable symptoms. However, as the disease progresses, the following signs and symptoms may appear. Urinary symptoms. Difficulty starting or stopping urination. A weak or interrupted urine stream. Increased frequency of urination, especially at night, nocturia. Pain or burning sensation during urination. Inability to completely empty the bladder. Blood in urine or semen. Hematuria, presence of blood in urine. Hematospermia, presence of blood in semen. Pain and discomfort, persistent pain in the back, hips, pelvis, or thighs. Painful ejaculation. Sexual dysfunction. Difficulty achieving or maintaining an erection, erectile dysfunction. Advanced symptoms if cancer has spread, bone pain or fractures. Unexplained weight loss, fatigue and weakness. It is essential to note that these symptoms can also result from non-cancerous conditions such as benign prostatic hyperplasia, BPH, or prostatitis, making proper diagnosis crucial. Causes and risk factors. Causes. The exact cause of prostate cancer is not well understood. However, it occurs when cells in the prostate undergo genetic mutations. These mutations cause the cells to grow and divide more rapidly than normal, eventually forming a tumor. In some cases, these cancerous cells may spread to other parts of the body, metastasize. Risk factors. Age. The risk increases significantly with age, especially after 50. Race and ethnicity. African American men have a higher risk of developing prostate cancer and tend to have more aggressive forms of the disease. Family history. A family history of prostate cancer or genetic mutations such as BRCA1 or BR2 increases risk. Diet and lifestyle. Diets high in red meat and high-fat dairy products with low intake of fruits and vegetables may increase risk. Hormonal factors. High levels of androgens, male hormones, may contribute to prostate cancer development. Environmental exposure. Exposure to certain chemicals or toxins, such as those used in farming, may increase risk. Diagnosis and screening. Screening methods. Prostate-specific antigen, PSA test. A blood test measuring PSA levels, which may be elevated in men with prostate cancer, though elevated levels can also be caused by BPH or infections. Digital rectal examination, DRE. A physical exam where a doctor feels the prostate through the rectal wall to check for abnormalities. Diagnostic tests. Biopsy. The definitive test for prostate cancer involves taking a small tissue sample from the prostate to be examined under a microscope. Imaging tests. MRI, magnetic resonance imaging, provides detailed images to detect abnormalities. CT scans, used to check for the spread of cancer. Bone scans, detect if cancer has spread to the bones. Genetic testing, determines the presence of genetic mutations associated with prostate cancer. Staging. After diagnosis, staging determines the extent of the cancer. Stage 1. Cancer is confined to the prostate and not visible on imaging. Stage 2. Tumor is still within the prostate but may be more advanced. Stage 3. Cancer has spread beyond the prostate to nearby tissues. Stage 4. Cancer has spread to lymph nodes, bones, or other organs. Treatment options. The choice of treatment depends on the cancer stage, the patient's overall health, and personal preferences. Common options include active surveillance and watchful waiting. For slow-growing cancers, regular monitoring with PSA tests, biopsies, and imaging is recommended. Treatment begins if the cancer shows signs of progression. Surgical options. Radical prostatectomy. Removal of the prostate gland and some surrounding tissues, often with nearby lymph nodes. Can be performed as an open surgery or minimally invasive robotic-assisted surgery. Transurethral resection of the prostate, TURP, removes part of the prostate to relieve urinary symptoms but is not curative. Radiation therapy. External beam radiation. High-energy rays target the prostate from outside the body. Brachytherapy. Involves placing radioactive seeds directly into the prostate. Hormone therapy. Androgen deprivation therapy. Reduces androgen levels or blocks their effect, slowing the growth of cancer cells. Medications. LHRH agonists or antagonists and anti-androgens. Orchiectomy. Surgical removal of testicles to lower testosterone levels. Chemotherapy. Uses drugs to kill rapidly dividing cancer cells. It is typically used for advanced or hormone-resistant cancers. Immunotherapy. Sipuleucel-T Prevenge. Custom-made vaccines stimulate the immune system to fight prostate cancer. Targeted therapy. Focuses on genetic mutations driving the cancer. For example, PARP inhibitors for patients with BRCA mutations. Bone-directed therapy. For cancers that have spread to the bones, drugs like bisphosphonates and denosumab help strengthen bones and reduce pain. Prognosis and survival rates. Prostate cancer has a high survival rate, especially when detected early. Localized prostate cancer, 5-year survival rate is nearly 100%. Regional spread, 5-year survival rate remains very high. Distant metastasis, the survival rate decreases significantly but varies depending on treatment and overall health. Lifestyle and support. Diet and exercise. A balanced diet rich in vegetables, fruits, whole grains, and lean proteins may reduce the risk of recurrence. Regular exercise helps improve quality of life and manage symptoms. Mental health support. Coping with cancer can be challenging. Support groups, counseling, and mental health professionals can provide emotional support. Follow-up care. Regular follow-ups with PSA tests, imaging, and physical exams are critical to detect recurrence or manage long-term side effects. Conclusion. Prostate cancer is a complex disease with a wide range of treatment options. Early detection through routine screening can lead to effective management and an excellent prognosis. Advances in research continue to improve outcomes and quality of life for patients at all stages of the disease. Always consult with healthcare professionals to tailor a treatment plan that best fits individual needs.